Every 6 minutes, someone in the United States dies from a blood clot. Even when a blood clot doesn't lead to death, it may still change a person's life in a bad way. In order to help you stay clear of these lethal clumps of red blood cells, we've compiled a list of 8 habits that increase your chances of getting a blood clot and some ideas on how to get around them. Let's get started. Number 1, physical inactivity. Physical inactivity, such as prolonged sitting or lying down, reduces blood flow in the legs. This can lead to the formation of blood clots, particularly in the deep veins, a condition that is known as deep vein thrombosis. When blood flow is sluggish, it can cause platelets and other components to cluster together and form clots. If these clots travel to the lungs, they can cause a pulmonary embolism. If they travel to the brain, they can cause a stroke. If they go to the heart, they can cause a heart attack. People who sit for extended periods of time, such as those with desk jobs or those who are bedridden, are at a very high risk. Our tip here is that if your job requires you to sit for too long, or if you're taking a long flight, you can improve your blood circulation by standing up and taking a short walk at least once every hour. If your work involves sitting at a computer desk for a long period of time, consider using a sit-stand desk. You know those? The ones that make you work while standing. They're really good for this. Also, avoid crossing your legs or sitting in positions that restrict blood flow. And consider going for a walk or stretching at lunchtime. Number 2, poor diet. Diets that are high in saturated fats, trans fats, and cholesterol can lead to the buildup of plaques in the arteries, a condition that is known professionally as atherosclerosis. Plaques can rupture and form clots, thereby blocking the flow of blood to critical areas like the heart and the brain. A diet low in fruits, vegetables, and fiber can also lead to elevated blood pressure and cholesterol levels, which increases the risk of clot formation. Consuming large amounts of processed foods, red meat, and sugary beverages can also increase the risk of getting blood clots. Therefore, our encouragement here is that you should eat more fresh vegetables and fruits and avoid or reduce red meat, processed foods, and sugary beverages. Number 3, smoking. Smoking damages the lining of blood vessels, making them more susceptible to plaque buildup and clot formation. It increases the levels of fibrinogen, a protein that is involved in clotting and promotes atherosclerosis. Smoking also reduces the level of high-density lipoprotein, which is a cholesterol that is protective against heart disease. Smokers and those who are exposed to secondhand smoke have a high risk of developing blood clots. Our tip on this one is that you quit smoking. If you stay or work with people who smoke, you can reduce your passive smoking by staying away when they are smoking or politely reminding them to go and smoke in a place where they will not expose others to smoke. If you smoke yourself, don't smoke around those who don't smoke. That way, you'll be reducing the exposure to secondhand smoking. Number 4, excessive alcohol consumption. Drinking alcohol, especially in excessive amounts, can lead to high blood pressure, an irregular heartbeat, and increased levels of certain fats in the blood. Chronic heavy drinking can also damage the heart muscle, thereby leading to conditions that predispose individuals to clot formation. Our tip here is that you consider quitting or reducing the intake of alcohol. Number 5, obesity. Excess body weight, particularly around the abdomen, can increase blood pressure and lead to higher levels of bad cholesterol and triglycerides. Obesity also promotes inflammation and can lead to the development of diabetes, which further increases the risk of clotting. Individuals who have a body mass index of over 30 have a higher chance of having blood clots. Our tip here is that you reduce your weight so that your BMI reduces to the normal range, which is between 18 and 24 to 25. Number 6, dehydration. Not drinking enough water can make the blood thicker and more prone to clotting. Dehydration can also cause blood vessels to constrict, which increases the risk of clot formation. Individuals who do not consume adequate fluids, especially during hot weather or when exercising, have a higher chance of blood clot formation. Our tip here is that you drink enough water. Number 7, certain types of medications. Some medications, such as oral contraceptives and hormone replacement therapy, increase the levels of clotting factors in the blood. This can lead to an increased risk of developing blood clots, particularly in individuals who are already predisposed due to other risk factors. The risk is higher for women taking birth control pills or hormone replacement therapy, especially if they smoke or are over 35. Our tip here is that you should only take medications when necessary and as prescribed by your doctor, and eat foods that reduce blood clot formation such as ginger, garlic, and many more. You can learn more about these foods by watching the video showing in the top right corner of your screen. It goes into details, giving clear examples of foods that can help you reduce the chances of getting a blood clot. Number 8, ignoring chronic conditions. Conditions like hypertension, diabetes, and high cholesterol need to be managed properly to reduce the risk of blood clots. High blood pressure can damage the inner lining of arteries, thereby making them more prone to atherosclerosis. Diabetes can lead to damage of blood vessels and increased levels of clotting factors. High cholesterol contributes to plaque buildup in arteries. The risk is higher for individuals who do not manage their chronic health conditions effectively. Our tip here is that you shouldn't ignore these conditions, and you should get regular checkups to know your status and commence management as soon as possible. Thank you for watching this video, and if you enjoyed it, you'll surely enjoy this next one that is talking about foods that dissolve blood clots. Have a good day.